what is the situation regarding the medical community in the tobacco harm reduction. What are the ethical aspects that should be taken in consideration? It's quite important that to put in perspective the problem, COVID-19 pandemic has been responsible at least for 4.5 million of deaths worldwide, and it has raised the concern of several organisms, associations, and decision makers all around the world about what to do. However, taking consideration that yearly there are more than 7 million deaths directly related to tobacco consumption. So we need to get back the attention to those problems that are still present and will be still present. For 2030, it's expected that 8 million deaths will be directly related to tobacco consumption. So something is needed to do. There is no doubt that tobacco consumption has been reducing during the time. This is a small picture regarding what happened in several countries, taking in consideration Chile, that is among the region, the one with the highest rate of consumption. We have here Colombia, for example, with the lowest one, and in the last decade, it has been reducing. However, it's not enough because it is pretty much dependent on what statistic are you using. The first one belongs to PAHO, Pan American Health Organization, where you can see numbers that are discordant with a recent publication in the Lancet Global Health, where we can see, for example, in the case of my country, we are talking here around 12%, while here it is 28%. What is one of the reasons for that? That unfortunately, although several actions has been put in place, we are a growing process all among the region about commercialization and consumption of illegal tobacco. That is important because it's not only the fact that illegal tobacco is harmful, it promotes also other very risky activities like child labor, informal work, and drug trafficking. It's quite important that it exposes children, particularly minors, to be joining this harmful activity because it is completely under control. It's not a matter to reflect the numbers, what sales of formal tobacco is showing. It's important to consider that we are with an additional problem. Another important point that was raised in the previous session is the refusal from several organizations, including World Health Organization, to openly discuss the use of alternatives to cigarette smoke. We clearly state here, smoke is dangerous. Smoke is not healthy. We need to do all kinds of efforts for smoking cessation. We need to put all kinds of efforts to prevent new smokers, particularly in younger people. However, what to do with those people that is already smoking? We fail from the medical point of view in only suggest you have to stop smoking. That is not a solution. We need to put in perspective any kind of support for those people that want to leave smoking, that need to stop smoking, but unfortunately are not having help with the current pharmacological strategies. Everyone knows that nicotine is an addictive substance and it's not easy to leave consumption of nicotine. But if we can get alternatives to reduce, and the key word is reduce the harm, all those alternatives need to be taken, need to be considered, and need to be discussed openly. The problem is that refuse to talk about, make difficult the process, make illicit the process, and then create a parallel problem that is what we are facing all among the region. It's quite important that when we review what is happening with new smokers, most of all them around the region in Latin America are joining to tobacco because regulations are not the proper ones. In most of the countries, it's prohibited to sell cigarettes to people under 18 years. However, not always it is accomplished in our region. From the point of the minimal selling, so we need to take in consideration the possibility to get alternatives openly discussed. For physicians, for healthcare professionals, it's important to get the advice for patients that are currently smoking, how we can support you to move from your current situation to a less harmful situation. Ideally, reduced harm products are not an alternative for maintaining the risk, but are a good option to reduce that process and to provide patients with an effective alternative to reduce consumption progressively and to get an alternative to a certain point, leave smoking. We hope and we aim that in Latin American countries, this can be an open discussion and that we as a region can take actions close to our reality to obtain better results than the current ones. This is my contribution for the later discussion. Thank you for your attention,